Dr. Isaac Bogoch joins me now. He's an infectious disease specialist in Toronto. Doctor, good morning. Thank you for being with us on this holiday Monday.
Good morning.
As things slowly start to return to normal, a new normal, is it likely that we're going to see a surge in new cases across many of these provinces?
I think, sadly, I think it's inevitable. I think as we lift these public health restrictions and people start to mingle a bit more, even with some of those measures in place, it just sets up a perfect stage for transmission of this infection. And, it's kind of to be expected. I think the key thing here is, do we have the tools in place? The access to diagnostics, the rapid contact tracing, the surveillance systems. Do we have these tools in place to rapidly respond to new cases so that we can really ensure that when we do get a spike in cases, we can jump on it quickly and prevent that from spiraling out of control?
So how important is it for Canadians to continue physical distancing, even as restrictions are relaxed?
I think it's extremely important. And certainly we hear of other provinces that perhaps have very few cases. For example, the maritime provinces taking, more liberal reopening measures. I don't disagree with that. I think it's fine. I mean, for example, New Brunswick's getting 0 to 1 new cases per day. There's just very little of the infection circulating in the community. It's just the question is not if, but when it gets reintroduced, we have to be able to rapidly identify it. So, physical distancing measures are, a very effective method, and depending on the location that people are in, I think they should certainly be adhered to.
Do you feel that some of the provinces are moving too quickly?
Yeah, my concerns are mainly with Ontario and Quebec, and we know Ontario is still having between 300 or 400 new cases per day. A lot of that's clustered around the GTA, but there's still cases elsewhere in the province, and of course Quebec is the epicenter, mainly around the Montreal area. Now we know that opening up of Montreal has been slowed down a bit. That plan to reopen schools has happened elsewhere in Quebec, but that plan is on hold for Montreal. And I think that was a good decision. But even then, if we start to see lifting of public health restrictions in those areas, it would come to no one's surprise that we see a spike in cases. And I really think the key measures are crucial to really ensure that we can rapidly identify and quell these cases when they come up, but also not to open up too soon.
And finally, over the weekend, we learned that Health Canada has approved a clinical vaccine trial. Your thoughts on that and how far away we are from a vaccine being developed?
Oh, that's really exciting. I mean, this is fantastic news. I know there's about 90 teams working on vaccinations worldwide. This is great because we have some Canadian input on it, and there's a good partnership with the Chinese group as well. So this is, they've had success in the past. So really hope there's success here. And this is the interesting part about this is they're working on what's called a phase 2 clinical trial, which basically means the earlier phases have been done. They've already shown that this vaccine is safe in humans, and now they're starting to look to see how well it works. So this is exciting. I still think it's going to take some time. We're probably, many months at best, probably closer to a year from having a vaccine. And of course, many people think it can even be longer than that because it's hard to develop a vaccine, especially for something like this. So I think we still have to be very patient here.
Dr. Bogoch, thanks so much. Appreciate your time with us.